CDC vaccine update today that breaks from what HHS Secretary RFK Jr. announced just a couple days ago. The Centers for Disease Control is recommending that children over 6 months old can get COVID shots after checking with a medical provider. The agency's new advice on children's COVID vaccines contradicts what the Health and Human Services Secretary said this week.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
So many experts worried RFK's new policy would spur insurance companies and government programs to drop the coverage for COVID shots. Let's welcome to the show Dr. Joel Warsh. She's a pediatrician and author of the new book, Between a Shot and a Hard Place. You seem like the perfect person to talk to about this today, so thanks for joining us.
Thanks for having me back on.
So who should people be listening to right now, the CDC or what we just heard from RFK there?
Well, I think it's really disappointing what we're seeing out of the CDC and the HHS right now. It's really confusing for parents. So I think the thing to do is to discuss with your own doctor. It's really disappointing that we're not having a unified front right now. And so it's hard to know who to listen to. We really need to be balancing risk versus benefits, and the CDC and the HHS and Secretary Kennedy need to be speaking to each other.
Yeah, and I follow you on social media, and you talk a lot about this. You even talk about how sometimes you feel like you're silenced because you're talking about this. You say some of the parents that come into your clinic do get their kids vaccinated and others don't. This latest clarification, though, from the CDC, it covers healthy kids 6 months old and older. But what about pregnant women? That's what I was thinking about, and then young infants, too, because my understanding is that then when the pregnant women are immunized, it covers the babies when they're infants because they were covered in utero. Is that right? So then they're quite vulnerable, aren't they? I mean, this is a population where if they get COVID and they're under 6 months or you're pregnant, I mean, things could be pretty gnarly, huh?
So that is correct. The recommendation was before this to give to pregnant women, and that's to pass antibodies onto the baby. The new recommendation seems to remove that. So I think that's something you could still discuss with your doctor. But again, it goes back to the fact that there are really two worlds of information here. Some people are saying that the COVID vaccine is the best thing ever and it protects you, and other people are saying it's the worst thing ever and that it's causing more problems than it's helping. And I think that's where we need to sit down, have discussion and debate, because I feel like everyone is weighing the risks versus the benefits differently. And that's why we're getting these different recommendations, which is really confusing. And they need to sit down, they need to have academic debates, and we need to come up with a plan that's unified so that people know what to do.
Yeah, well, I can hear your frustration. And I know you, in large part, you're a big supporter of the MAHA movement. So it's nice to hear you, sharing your true feelings on everything. The CDC is also stepping up measles travel warnings as cases surge. We have our reporter on that today. Are you concerned that vaccine hesitancy in this country is fueling this outbreak? How bad could it get? Is there fear mongering going on about it?
I think it's a mix of everything. I think that there is a little bit more fear than we need, but we certainly need to have awareness. I mean, we're definitely having a worse measles outbreak than we had last year, but there's always cases of measles. We're always having hundreds, if not a few thousand cases every year. And so it's not something that's new, but it's definitely worse this year. And I think that is in big part because of the decreasing vaccination rates. We know that the measles vaccine works very well. And if you get both vaccines, you're covered about 97% of the time. But a lot more people are unvaccinated. There's a lot more hesitancy. There's a lot more concern because of this back and forth, because of COVID, because of what we've seen over the last few years. And I think there's a lot of hesitancy because there's a serious lack of trust in medicine and our institutions. And when the HHS and the CDC can't even agree, that's not helping.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.